The number of Idaho children getting vaccinated continues to drop, specifically when it comes to the measles, mumps, and rubella vaccine. And Idaho is not alone. Data collected and analyzed by NBC News in partnership with Stanford University shows more than 3/4 of counties in the country have seen a decline in their vaccination rates among kindergartners since 2019. I dug through the data and have the latest on the vaccine divide. More than 1/4 of Idaho kindergartners started school last year without being fully vaccinated. Less than 72% were up to date on all their vaccines, a big drop from 84% in 2019. The decline puts Idaho dead last among all 50 states for kindergarten vaccination rates, and the consequences are showing. 3 measles cases have been confirmed in Idaho this year, the first in some counties in more than 30 years.
I appreciate parents' right to choose for their children, but we do worry when the rates drop below where we think kids might be protected.
State epidemiologist Dr. Christine Hahn points out some kids can't get vaccinated because their immune systems can't handle it.
We do worry about those children potentially not being protected by others being vaccinated, and we do worry about outbreaks in schools at a certain point.
For measles specifically, herd or community immunity requires a 95% vaccination rate. Data from NBC News shows most Idaho counties fall dangerously short of that threshold, leaving entire communities vulnerable to outbreaks of a disease that was once nearly eliminated from American schools. Measles is extremely contagious and can be dangerous. Dr. Hahn says about 1 in 5 children under 5 who get it end up hospitalized.
It can cause a pneumonia, it can cause swelling in the brain, it can cause all sorts of terrible infections, and very rarely death.
Tracy Garner,
I'm the health services supervisor here at West Ada School District.
says school districts collect immunization data and give it to health and welfare.
We're not responsible for whether they get them or not.
Right.
We're responsible for making sure that we have information so that if we're presented with that case of measles, we can quickly protect the environment and remove those who haven't been vaccinated while protecting those who have.
Garner says parents have to provide one of 3 documents when enrolling their child in kindergarten: a complete immunization record, an exemption, or a conditional admission.
Conditional admission is for those children that have started getting the vaccine process later and are playing on a catch-up schedule.
The state of Idaho allows broad exemptions for medical, religious, or personal beliefs. And more parents are using them. Exemptions jumped from 8% to 13% statewide over 6 years, more than doubling in some Idaho counties.
Our data will show that the rate of exemptions is increasing, but I think more again, the number of incomplete vaccines we are seeing consistent with the nationwide trend.
The trend accelerated after COVID.
We look at our immunization rates, they were holding steady. They weren't always where we wanted them to be, but they were kind of holding steady. But really since the COVID pandemic, we have seen, just like the rest of the nation, declining rates of immunizations at kindergarten entry.
Experts point to several factors behind Idaho's low vaccination rates: broad exemption laws, skepticism around public health mandates, distrust of vaccines, a strong culture of individual and parental choice, and access barriers in rural parts of the state.
There are parents that, first of all, they don't know anybody ever who's had measles or who's had polio. And so they're like, well, the disease seems to be gone. Why would I expose my child to anything that might have any risk to it? I understand that calculation, but it's important to know that those diseases are not gone. So I think parents have made the decision that they don't want to take any risks that are unnecessary, totally understandable. But hopefully, with new information, talking to the doctors, talking to a trusted healthcare provider, they can think about whether they want to risk that for their child, that they're exposed to somebody at school or somebody when they're out on traveling that might give them a disease that can be very, very serious.
And Dr. Hahn points out misinformation spread years ago linking the MMR vaccine to autism, but that has been debunked. Like any medication, vaccines can have side effects.
Sure.
Some people can get a fever, a mild rash, and a sore arm from the shot. The CDC says getting the MMR vaccine is much safer than getting measles, mumps, or rubella.
Because you are getting a little bit of it in the vaccine. When it comes to vaccines in schools, under Idaho law, students who don't meet vaccination requirements can be banned from school until compliant. And Garner says it doesn't usually get to that point, though, because school nurses connect with families and they have them fill out those exemptions or conditional admission documents. However, even kids with exemptions can be barred during these disease outbreaks. Health and Welfare says generally an outbreak is defined as 3 or more linked cases.